Hey, my name is Molly Cheng. Today I'm going to demonstrate a head, ear, eye, nose, and throat, mouth, and neck physical exam on a patient. This is Gina. She's gonna be my patient today for the physical exam. So first, we're gonna start from the head. So we're gonna look at the face and then look at the facial expression and then see the facial nerve is normal. And then we're gonna palpate the scalp and the head. So we're gonna check the hair, see if there's any lesion or scar, and also check the skull size. And next we're gonna go ahead and check the sinus. So we're gonna check the frontal sinus first. This is frontal sinus. And we're gonna check the maxillary sinus. And very good. There's no painful reaction, so the sinus look good. And then we're gonna go ahead and feel the temporal artery. Feel the pulse on the artery. I can feel the pulse, so that's very good. It's normal. And then we're gonna go ahead and feel the lymph nodes on the head area. So first we're gonna start with the occipital lymph nodes. Then we're gonna go ahead, go down to the post-auricular lymph nodes, pre-auricular lymph nodes, submental, tonsillar, and submandibular lymph nodes. And then further down we have the posterior cervical lymph nodes, anterior cervical lymph nodes, and then we have the supraclavicle lymph nodes, and then infraclavicle lymph nodes. So everything feels normal on Gina in terms of the lymph nodes. And next we're gonna go ahead and check the TMJ, the temporal mandibular joints. So we're gonna have Gina to open and close the mouth. Open the mouth and close the mouth. It's very good. And then I'm gonna feel the TMJ muscle. So Gina is gonna clench. Yeah. Very good. So the muscle's good. That's to test the trigeminal nerve. So the next one, the final one for the head exam, we're gonna have the patient to smile and puff the cheek. Smile and then puff the cheek. Very good. That's to test the facial nerve. So after the head exam, we're gonna go ahead do the eye exam. So first, we're gonna do the eye vision acuity test. So we have this Snell chart, so we can check the patient's acuity, vision acuity. So I'm just gonna show the chart here, but just gonna to let the doctors trust know that I did the vision acuity check. For the near vision, I'm gonna have the patient to look at the newspaper, to read the newspaper. So this is to check the near vision, just to have the patient read the newspaper. And that's very good. Thank you, Gina.
You're welcome.
And then go ahead. We're gonna just inspect the eyes. And we're gonna look at the symmetry of the eye, see the position of the eye is good. And then next, after the inspection of the eye, we're gonna palpate the eyes just to check the conjunctiva and the corneal, and just to check if there's anything abnormal. So we're gonna palpate and check the eye, the corneal color, and to see if there's any sign of infection. And the color of the cornea should be white, and just to make sure there's no lesion or infection. And then next we're gonna go ahead and check the gonna go ahead and check the eye on the pupil. We're gonna check the corneal light reflection. I'm gonna use the pen light to check the eye of the corneal reflection. See if I can see the reflection on the both eyes cornea. I can see the reflection on both eyes on the cornea very good. So that part is normal. And then also I'm gonna go ahead and, since I have the pen light, I'm gonna go ahead and check the pupil reflection, pupil equity, pupil accommodation. So I'm gonna flash the light and check the pupil and see the pupil contract. Very good. The pupil contract. That's very good. That's to check the cranial nerve 3, 4, and 6. And next I'm gonna do a cover and uncover exam. So I'm gonna put this paper just to cover Gina's eye, and then I'm gonna remove the card just to see if there's abnormal pupil reaction. And then next I'm going to do a confrontation test. So this is to check the patient's peripheral vision. So I'm gonna have Gina to say now if she can see my finger comes to her vision.
No.
Good. The other side.
No.
Very good. That's the confrontation test. And then I'm going to go ahead and do the 6 cardinal gaze test and also the convergent test. So for this test, I'm going to have Gina look at my finger. So I'm gonna have Gina look up and side and down, and also to the other side. And I have Gina look my finger up, side, and down. Very good. And then I'm gonna go ahead and do the conversion test. So I'm gonna have Gina look at my finger from far to near. Very good. She has very good reaction on that test. So next, we're gonna go ahead and do ophthalmoscope to check the red reflex. So I'm gonna go ahead and use the scope to check on Gina's eye to see if I can see the red reflex. Very good. I can see the red reflex on this eye, and then going to check the other eye. I can see the red reflex. Very good. And the next, we're gonna go ahead and do. So we finished the eye exam. We're gonna go ahead and do the ear exam. So for the ear exam, first we're gonna do the audio test. We have 3 audio tests. First, I'm going to do a whisper test. So I'm gonna say some words and Gina is gonna say what I say. Apple. So she said apple. Very good. I'm gonna test the other side.
Light.
Light. She said light. So very good. Go ahead. Next, we're gonna do the Weber test. I'm gonna use the tuning fork to do the Weber test.
Yeah. No.
Okay. She can hear equally both ears. Then next, I'm going to demonstrate the ring test. I'm gonna put it behind the ear.
No.
Good. And the next to the ear. Very good. So that's to check the audio nerve. And next we're gonna we're gonna also inspect the ear to check if there's any this formation. And look at the ear first and check the ear, pinna and the tegra and the mastoid process. See if there's anything, is it swelling, is there lesion or any scar. But everything looks normal on Gina's ear. And next we are going to do internal ear exam. So we're going to use the otoscope to look at the inside of the ear. So I want to pull up and check the tympanic membrane. Looks normal this side. Go ahead and check the other side. It looks normal. I can see all the landmark very well. So the ear looks okay. So this is the part of the ear exam. And then next we're gonna go ahead and check the nose. First we're gonna inspect the nose, see if there's abnormal scar, and then we're gonna palpate the nose. And everything looks fine. Everything looks good. And then we're gonna go ahead and check the nose structure. We wanna make sure the deviation is good and the patency is good, and the both deviation and patency is good. And the next we're gonna go ahead and check inside of the nose. So we're gonna check the mucosa and see if there's redness of the inside of the nose, and check the turbinate too. Everything looks fine. Very good, very normal. So after the nose, we're gonna go ahead and check the mouth. So first we're gonna inspect outside of the mouth, which we're gonna check lips, and then we're gonna check the gums inside the mouth, and check the teeth, and check the uvula, and soft palate, hard palate. So we're gonna go ahead and check it. So I'm gonna open your mouth, Gina. I can see the teeth, and the tonsil is at grade 1. It's not touching each other. The gums looks very healthy. And say to check the soft palates. And that's for the cranial nerve 9, glossopharyngeal nerve. And also I would like Gina to swallow some water to check the swallowing test, and that's to check the cranial nerve 10, which is the vagus nerve. So can you drink some water, Gina? Very good. I can see Gina swallowing water very good. So that part is normal. And so these are the test and exam on the throat and so in the mouth. So we're gonna go ahead and do the next exam, which is the neck. So for the neck, first we wanna inspect the neck. We're gonna make sure the trachea is in the midline and it's not toward one side or the other side. So Gina's trachea is in the midline, so that's very normal. And then next we're gonna palpate the thyroid. So we're gonna palpate the right side, and I'm gonna palpate the left side. And thyroid is within the normal size and shape. So that's very good. Sorry. And sorry. And then next we're gonna go ahead and have Gina to to push against my hand. Push up your shoulder. Yeah, very good. That's to check the mystoid muscle, to check the accessory nerve. I'm sorry, I'm just coughing right now. And then we're gonna, sorry, we're gonna listen to the carotid buoy. See if there's any buoy I can hear. I can't hear any buoy, so that's normal. And then we're gonna also to feel the pulse of the carotid pulse. I can feel the pulse very good, so that part is normal too. And I'm sorry. Ooh. And so that's the physical exam of head and ear, nose, and eyes, and throat, and mouth, and neck. And above this, my physical exam. Thank you very much.
Thank you.